Breast lift is a procedure in which the patients usually have enough breast tissue volume, but because of increase in size with age or after pregnancies, there has been droopiness of the breast. So to correct that, breast lift is the operation which is more appropriate from them. Also, patients who want to have a more youthful breast but do not want breast implants, for them also breast lift is a very good operation. The process for the breast lift is, it always starts with a proper examination to see what is the shape of the breast, what is the quality of the skin, and what is the correct nipple position. Once we get all those proper dimensions and we analyze all those different facts, then we come up with a plan as to where the nipple should be, and how we're going to address the issue of the skin excess. Many times there are patients most of the breasts are asymmetric, and one side is larger than the other. So we do a small reduction on the larger side to get a better breast symmetry. I think a good candidate is a patient that has enough breast tissue and good quality skin to achieve that result. There's a subset of patients who have lost a lot of weight and they don't have enough breast tissue. So there's a lot of skin excess and the nipple is positioned quite low. For them, the best option is to have a combination of a breast augmentation and a lift to give them the look, feel that they desire. The surgery for the breast lift varies from what size the patient is, but usually it takes about 2 hours of operating time to get the desired result. Now, if they're combining a breast augmentation and a lift both, then it can take about 2.5 hours to 3 hours. So the first step is for the patient to make the right choice of the plastic surgeon and pick up the phone, make a phone call or email to make an appointment. They should also do their homework, read the reviews, look at before and after results of the surgeon. So when they come to the office, they have some idea as how they want to look like and what are the credentials of the surgeon. So there are a few things that are addressed during the breast lift. Number one, there is the repositioning of the nipple to make it more of an aesthetically pleasing location rather than the lower position. Second is to remove enough skin. And sometimes you have to rearrange the breast tissue to get the desired result. So all these three factors, the nipple position, the skin access, and the breast tissue. These are the three main components. And that comes with more experience as to what will give the patient the best result. Scarring is always an issue. But the way the breast lift works is most of the scars are not visible to the patient. The scars do tend to heal very well, and after 1 year they are barely visible. However, there is a period of healing during which time the scar will stay red. We do advise the patients to avoid any direct sunlight exposure when the scar is red, because when the scar is red and is exposed to sunlight, it will tan purple, and there's a permanent tan, it cannot be removed. So once the scars turn white, then the patients can expose them to sunlight. The question always is the shape versus the scar. I do show the patients my results, and they're so excited to see the nice shape, roundness, and fullness that the scar becomes a secondary issue. Difficult question to answer because it's very dependent upon the patients, what patient's expectations are, and how much tissue the patient previously has. If she's happy with the size that fills in the bra and she just wants tightening of the skin and the nipple to be repositioned, then they'll be extremely happy. In my own personal practice, the patient satisfaction is about 98%. However, if they do want to have a slightly bigger breast, sometimes you can rearrange the existing breast tissue in such a way that can give you more fullness on the top. But if they really want more fullness on the top, then the best option for them is to have a small implant as well. So the answer to your question is to it all depends upon setting up realistic expectations and what materials do we have to start off with.